So, good morning, everybody. Bonjour tout le monde. Um, I don't think you actually need a statement from me, although I have to say I was glad the FAO came out with a report. I thought it was very revealing of what's going on. I'm very happy to answer your questions.
So yeah, 8.4 billion. Um, it's a lot of money. It's almost as much as they think they would have saved from Bill 124. What does this point to for you?
Well, first of all, it points to the fact that we have gone through this whole process where our hospitals have been put into crisis uh, in a situation where, in fact, we may have to put out the money in the end anyway if the courts find that the government acted in a way that was unconstitutional. Uh, I don't think these are savings that have served Ontario well. If you've gone to an emergency room that's been closed, if you're one of the parents whose children is not getting pediatric surgery because of the backlog, because the hospitals are understaffed, you are not going to see this as a good thing. What you're going to see is the price to Ontarians to taking an approach that's punishing the people who work for us and try to make sure we're healthy and looked after.
What should the government be doing at this point then, hearing this number? Should they just be repealing Bill 124 immediately?
Yes, they should be canceling Bill 124. They should be making sure that we have the healthcare workers, the education workers in place so that Ontarians get the services that they deserve and that they need.
Going forward, how's the province going to be able to fill all of these positions that they need to fill in healthcare if Bill 124 is still in place? I mean, there's 159,000, or at least 103,000 healthcare workers who are going to be impacted by Bill 124 going forward. How can the province fill that gap, do you think, if it doesn't increase wages?
I don't see how they can fill the gap if they don't increase the wages. We look at labor markets right now. There's demand for employees. A lot of people took early retirement through the pandemic. If we're actually going to have those healthcare services, we're going to have to pay people decently. We're going to have to pay them what they're worth. And the province is going to have to face up to that. They cannot balance their budget on the backs of the people who've risked their lives in our hospitals and clinics these last few years.
Peter, peut-être en français, un peu sur la même chose sur la pénurie de personnel. Le Bureau de la responsabilité financière disait on a un surplus, donc il y a une certaine flexibilité, une certaine marge de manœuvre pour augmenter les salaires. Pensez-vous que c'est ce que le gouvernement devrait faire?
Je pense que vous avez raison. Il y a une flexibilité pour le gouvernement et c'est nécessaire d'utiliser cette flexibilité et payer oh mon Dieu, un manque de vocabulaire. C'est nécessaire de payer les salaires qui sont nécessaires de retenir les emplois. Ça marche? Bon. Other questions?
What was your reaction when you saw that number?
I thought that that's a lot of people who were underpaid for a long time. No wonder they're leaving our hospitals.
Short and sweet.
Thank you very much.
Sweet.